So I'd like to just hand finally over to Dr. Ayesha Rahim. Ayesha's a CCIO at Lancs and South Cumbria NHS Trust, and she's just going to make some final comments really on the speakers that we've had over the last 2 days and all the content that we've covered. I know people have asked if these sessions are being recorded. They are. We will share with them. We will share them with you via a number of platforms, I have no doubt, but we'll probably also cut them down into little chunks as well and bring out some of the real salient points that you've heard today. So without further ado, thank you all, and I'll hand over to Ayesha for her final comments. Thank you.
Thank you very much for that, Lou. What I'd like to do now is to do a bit of summing up, a bit of housekeeping, and I think we did have a question for Owen as well. So before I move on to that, it's a question from Ros from M Habitat, Owen, so if that's okay with you to answer this. In the past, the conversation in the NHS around health inequalities has often ended in, it's not our job to tackle the root causes. So Owen, how would you respond to that? And what tangible actions do you think that different elements of the NHS can take around that?
Okay, thanks for that. I think it's quite straightforward really, because if all you see as you have been a part of the NHS is that all you are is involved in the care of somebody, I can see how people may get to a conclusion that says, you know, it's not our job to tackle the root causes. But if I take our organisation, and not only are we in the business of, you know, what I would call a good birth, a good life, and a good death, we also can't do that alone, and we have to work with other organisations. But more importantly, we have to work with local people. And it is also a fact that we're not just a trust, we're not just an organisation that provides acute and community care. We're actually an anchor institution that is part and parcel. You know, this is not my trust, this is an organisation that belongs to its communities. We've got 2,100 people that live in the Calderdale area. We've got 2,400 people that live in the Kirklees area. We've got 200 people that live in Bradford. We've got 129 that live in Leeds. These are all people who are making contributions to society. As the NHS, we produce some of the highest sustainable emissions that you can think of. Again, we've got a role to play in terms of reducing what I would call care miles. So whether it's household income, so people often think about the NHS as paying salaries and so on and so forth. Actually, we contribute to household income. That is a determinant of health inequalities. We contribute to housing, we contribute to education, we contribute to health. So actually, it's a nonsense to say that we don't have a role to play and we can't tackle the root causes. Of course we can, and we should be looking to really expand on what we do.
Thank you very much for that, Owen. I completely endorse what you're saying. And I think most of us, all of us, I hope, are very much enjoying the fact that health and social care are coming together in the way that perhaps they haven't done in previous years. And, you know, exactly that, tackling those social determinants of health inequalities, I think is key for us all achieving the aim that we want to get to. So thank you very much for your comments, Owen. So moving on now to summarise the day, I mean, what an incredible diversity of speakers, experiences and perspectives that we've heard over the last couple of days. I've certainly learned huge amounts. So just to recap some of what we've heard today, you heard from Shira and Ajoma at the start of the day from the Shuri Network. And of course, I will give them another plug. So please do join our network, learn about what we're doing and actually become an ally as well. You don't have to be a BAME woman to join the ally and to offer shadowing experiences to our members. Please do watch out on social media for more news around what we've got coming up in the pipeline. We heard a local authority perspective, going back to the social care discourse that we've just been having, and how Bradford City Council have made huge strides in their representation, but also hearing some really quite upsetting experiences that Shemin had faced, but her being able to turn that into a positive to lift people up, I think is incredibly inspiring for all of us. We heard from Salat Chowdhury from the National Centre for Diversity and the acronym FREDDIE, which is imprinted on my brain now. So fairness, respect, equality, diversity, inclusion and engagement. I think I've got that right, but that's certainly a really handy way to conceptualise what we're all trying to get to pass it on to our organisations and our networks. We heard from Erica talking about the real life stark impact of health inequalities on people's lives and the impact that gender and ethnicity has on some of those life altering, life changing results that you can see as a function of those inequalities. We heard Habitats, we in the form of Roz and Sana, and the quotes from that have really stuck with me as well. Inequality costs lives and money. That's really stark again, isn't it? We heard from Richard Stubbs from the Yorkshire AHSN, and Richard and his team leading from the front, really talking about diversity and innovation. And I think you'll see some links in the chat to some of the references that he made there to reports and schemes. So please do click on those links, follow that up. And we heard from Taz Alderwood talking about Dockabode, but also I learnt some new words, homophily, people like people that are like them. So actually the more diverse that we get as organisations, as institutions, the more we amplify that effect by being diverse. And then finally, of course, hearing from Owen and another word, diversiast, that's new to me. And I don't know, diversiasm, is that the noun that's associated with that? Maybe that's a new one too, but certainly that's made me think differently about diversity and opened my eyes even further. So I hope you found this a really fantastic learning opportunity. I certainly have. So I'd like to thank all of our speakers. It's been absolutely just such a pleasure to hear from everybody's different perspectives. So thank you so much for doing that. But I'd also like to thank our technical support team from NHS England, to Fiona, to Charlotte and to Leon for helping this go as smoothly as it has done. So big up to you guys. Thank you very much for that. Thank you very much, of course, to Paul Rice and Louise Sinclair, without whom this conference wouldn't have taken place at all. So it's been so professional. It's been an absolute joy to work with you both. So thank you very much for helping to put this on. And of course, thank you to all you as attendees as well. You know, we wouldn't be here with any purpose if we didn't have people that were engaging and tuning in and listening to all the fantastic speakers that we've had. So some of you have asked if the sessions will be available afterwards, and with permission from the speakers, we will of course be publishing videos and snippets of videos on social media, so do please look out for that. And then you'll see on the screen in front of you a QR code. So what we'd really like to do is to hear from you in terms of your feedback about this conference. What do we get right? What would you like to see in the future? Because actually that's how we grow. And also it's a really short survey and it has some questions about your own organisation's attitude to diversity and inclusion. So please do scan the QR code and we will collate those responses and use them to design our events going forward. And really, I think the final thought I'd like to leave you all with is around next steps. So we've talked about ethnicity and gender in today's conference and yesterday's session as well. But actually, we want to broaden the narrative and look at diversity in all its forms. And we've heard about the importance of neurodiversity from Taz Alderwood, of course, but also disability, sexuality, sexual orientation. It's about diversity in all its forms, of course. So that certainly sparked some thoughts in my mind. And finally from me, what is a pledge that you're going to make, having attended this amazing conference this past couple of days? I'm certainly going to pledge to reach out more, offer opportunities where I can to people that want to get more involved in this field of digital health. So do please have a think about what your pledge is going to be, having listened to today's conference. So I think that's about it from me. So I really hope you've enjoyed the session over the last couple of days. Please do feedback to us, stay safe, and I hope we see you again at future conferences. Thank you very much, everybody.